So we are done with tubular interstitial diseases. Let's move on to the cystic diseases of the kidney. So there are numerous cystic diseases of the kidney. We will concentrate upon the major types only. So the major ones will be autosomal dominant and autosomal recessive polycystic kidney disease. So autosomal dominant, any autosomal dominant, it is going to present at a later later stage of age. So but in any autosomal recessive, it usually presents in childhood. This we all know, right? So here it is going to be presenting in adult, here it is going to present in child. And the mutations involved in autosomal dominant polycystic kidney disease will be polycystin 1 and polycystin 2 mutations. That is, PKD 1 and 2 genes will be mutated here. And the cysts here are not just restricted to the renal system. There will be associated seen in the other organs as well, like in the liver, spleen, pancreas and lung as well. Also, there can be extra-renal and extra-cystic manifestations like berry aneurysm. The very common renal manifestation will be a berry aneurysm in the brain, and this berry aneurysm can rupture and cause intracranial hemorrhage. Other than that, we can also see mitral valve prolapse. We know mitral valve prolapse is also called as Barlow syndrome, right? It is a degenerative condition of the mitral valve. And then we can also have colonic diverticulosis. So what is the gross image of autosomal dominant kidney disease? Here, the kidneys will be very much enlarged and cystic. So the cysts will be variable in number, starting from smaller size to larger size. And the cysts will be seen both on the external surface and also on the cut surface. Okay. So this image is the cut surface on which you are going to see multiple dilated cysts. On the external surface also, you are seeing this n number of cysts. Okay. This is the classical image which we see in the autosomal dominant kidney disease. And here the cysts can be seen on both the cortex and medulla. So the corticomedullary junction is going to get obliterated because entirely the kidney is going to have cysts. And the origin of this cyst is from the tubular linings. So the tubules only are going to get dilated and form this cyst, and it can happen in any of the tubules, proximal convoluted, distal convoluted or collecting duct. So any of the tubules can form this cysts. And eventually these patients will undergo a chronic renal failure. So in autosomal recessive polycystic kidney disease, again, it's going to be presented in a child, and then the mutation here will be that of a fibrocystin protein. So the gene encoding for fibrocystin will be PKHD. So there is a H extra in this, okay, PKHD1 mutation. And here the very classical feature you see other than the renal cyst will be congenital hepatic fibrosis. So autosomal recessive PKD will be associated with congenital hepatic fibrosis. And you can also have hepatic cysts. So what is the gross appearance of the kidney in ARPKD? So here again the kidneys will be enlarged and the external surface will kind of be lobulated, but you don't see the cysts. But in ADPKD, we were able to see the cyst on the external surface, but here in ARPKD, you'll not be able to see the cyst on the external surface. Only on the cut surface here, you can see the cysts, and the cysts are usually cylindrical. They are cylindrical like this, and they are arranged perpendicular to the cortex. So all of these are the cysts. Okay, and the cyst can involve both the cortex and medulla as in a ADPKD. Okay, but the origin of the cyst here will be from the collecting duct. While ADPKD, it was from all of the tubules, while ARPKD, you will have the origin from the collecting ducts. Then we'll see about the other kidney disease, cystic kidney diseases also. So there is a kidney disease called as medullary sponge kidney. So medullary sponge kidney, it will again present in the adults, wherein the kidney size here will be normal and the renal function will also be normal. Okay, but there will be benign cysts present in the medulla. As the name suggests, there is going to be medullary cysts. Then there is another cystic condition called as juvenile nephronophthisis. So in juvenile nephronophthisis, as the name suggests, it is going to be present in juvenile, so kids, childhood, and the cyst here will be present at the corticomedullary junction. So junctional cyst will be seen in juvenile nephronophthisis, and here the kidney is going to be shrunken. In ADPKD and ARPKD, we saw the kidney was enlarged, while in medullary sponge kidney, the kidney was normal in size, while in juvenile nephronophthisis, the kidney is going to be shrunken. And here, it can result in end-stage renal disease or chronic renal failure.